I was reading a blog post that you penned recently, and in it you used the phrase that personalization in healthcare starts with search.
Hmm.
And I found that kind of really a fascinating tagline. Would love for you to take a few minutes and maybe just expand more on what you mean by that.
Yes. When I was at Google, I would log into a technology called Wildcat, and that was where they were able to showcase all of the searches that were happening globally in any industry. I could see the evolution of how people searched from 2007 to when I left. And
Okay.
so people would search for doctor. Then maybe a few years later, they might search for a doctor near me or cardiologist. Then by the time I left, people were searching in a very complex way. I'm looking for a primary care provider near me who accepts Aetna insurance. And we would see that a lot of organizations couldn't necessarily connect the dots to make sure that they're showing the right information when somebody was searching. When I started thinking about what organizations are doing with personalization, a lot of were saying, I want to be able to tap into that type of category. I want to tap into people who are looking for cardiologists. So I want to look for heart patients. What I was thinking was that it's actually the flip version of that. If you take a look at every single search, you realize that every search is a personalized intent or a personalized ask of Google or of the search box because somebody has a need and they want a personalized response back. And when I talk about personalization, every element has to start with search. I like to talk about it every time there is a unique opportunity to deliver on what it is that you might provide as a healthcare organization. And that therefore will fulfill a lot of different things. It'll help the patient find the information, but it'll also drive a lot better patient experience. There's so many things that if we could just tap into that individual search, it unfolds so much for the organization and for the providers who can deliver on that.